Module 6. How is the NCLEX administered? The NCLEX exams are given utilizing updated versatile testing, which is a type of testing, CAT. This means that the PC will re-evaluate your nursing competence based on your responses and the difficulty of the questions each time you answer one. This technique is designed to present you with questions that are sufficiently challenging based on your previous responses to give you a 50% chance of answering correctly. When you get to the test place upon the arrival of your exam, you'll need to introduce a correct type of identification, read and sign the paperwork, store individual belongings, and continue to the testing room. Here, you'll have as long as 6 hours to finish the exam. If that appears like an inordinately long measure of time for a test, you can have confidence knowing that you'll have ample time to think through each question. There are no less than 2 predetermined breaks presented during the exam. This testing approach also means that the duration of the test may vary from one candidate to the next. If you're on the verge of passing, you'll be quizzed until you either run out of time or gain enough confidence by correctly answering enough questions. While this may appear complicated, there are valid justifications for this configuration. For one's purposes, a high-ability candidate passing based exclusively on their ability to answer the easy questions accurately is anything but an incredible impression of their ability to work in a natural setting. Additionally, providing a progression of high-difficulty questions to a marginal candidate frequently prompts guessing. A suitable series of guesses leading to a passing outcome isn't great either. This responsive organisation fosters a superior check of a nurse's overall ability. How is the NCLEX RN exam scored? The NCLEX RN is graded using an impressive system. This exam's pointing will show, based on logit, it will not making pointing with the correct answer. If it isn't 95% certain of your outcomes, you will continue to see questions until it is inevitable, or until you arrive at the limit of 265 questions. Then, if you reach the greatest, it will do a final assessment to determine whether or not you have fulfilled the passing standard. Think of it along these lines. There is an even line on a pivot, and I will call it the pass line. Anything above it is passing, and anything beneath it isn't passing. So you start precisely on the line at question 0. And with each right and incorrect answer, you get knocked up an indent and down a score separately. The PC will give dynamically more complex questions to determine your pinnacle information with each correct answer. This may all sound a little complicated, but basically, the better you do, the fewer questions you have to answer. But even if you wind up having to answer 265 questions, you may, in any case, pass the exam. If you have fulfilled the passing guideline, you will essentially be informed that you passed the exam. However, you will just see a definite report of how you performed on each test segment if you fizzled. A logit is a measurement unit that indicates the general difference between your assessed ability level based on your education, training, and experience, and your actual ability level, based on how you performed on the test. At regular periods, the board re-examines the passing standard. You'll need a logit of 0.00 or above right now. This logit varied depending on your number of answers, and it always changing. The test will terminate when you have completed 75 questions, and the computer software can decide whether you have passed or failed with 95% accuracy. There will be a minimum of 75 questions and a maximum of 265 questions on the test. When the tester answers enough questions correctly to stay over the pass line, with a 95% confidence interval, the candidate passes the test. In contrast, if the candidate does not rise above the pass line with 95% certainty, they will fail the test. To pass, you must, at last, transcend the pass line that demonstrates competency with marginal uncertainty, The test can end any time this determination is made, between questions 75 to 265 or at the maximum time allowance, 6 hours. After failing the NCLEX exam, what should you do? If any candidate fails to their exam, then it will take few days to take the retake exam. Every exam attempt costs $200, so it's in the best interests of nursing grads to make the most of their time and money by passing the first time. Which percentage do you have to get on the NCLEX to pass? There is certainly not a specific number or rate that you need to answer accurately to pass the NCLEX. Instead, the exam's computational algorithm assesses the correct answers within the context of their difficulty and an assortment of topic information. The versatile test will determine that you are at an adequate level to pass in each branch of knowledge using a 95% confidence rule, or a choice will be made at the most extreme time, 6-hour imprint, or maximum question allowance, 265. Comparing NCLEX PN versus NCLEX RN. What are the real distinctions between the NCLEX PN and NCLEX RN exams? When it comes to the overall organisation, there are more parallels than differences. However, there are minor variances in the number of questions and time limit on the tests. The majority of the variation is due to the content of the questions. However, LPNs and RNs both give care to patients. RNs have an increased extent of the practice, and the NCLEX RN questions mirror that. Since registered nurses can supervise LPNs, the NCLEX RN contains more questions on managing others, while the NCLEX APN focuses on coordinating consideration between health professionals. RNs can also oversee total parenteral nutrition and the administration of blood and blood items to patients, so questions on the two topics are included on the NCLEX RN. However, the tests cover different material. The two give a thorough assessment of a nurse's critical abilities for practicing at their qualification level. How the next generation NCLEX exam works. The NCSBN has made a model that addresses the few phases of specialised ability and information that nurses must show skill in to pass the NCELEX. An exceptional exploration segment was added to the furthest limit of NCLEX exams that was intended to gather information on new item types that could expand or improve the measurement of entry-level nursing ability that includes clinical judgment. Accordingly, the clinical judgment model was made to enhance the NCLEX exam and guarantee that all nursing students working toward an ADN or BSN are ready for their choices in certifiable medical situations.